Again, my disclosure statement, this material is not my own, and any recording is for nursing school student use only, not providing medical advice. So we're going to start in chapter 31, Rest and Sleep. Sleep versus rest. Sleep is cyclical states of altered consciousness, decreased motor activity, perception, and selective response to external stimuli. Rest, on the other hand, is mild or no activity, relaxation, stress-free, and leads to a feeling of being refreshed. The benefits of sleep: increase mental performance, improves learning, improves storage of long-term memory, restores energy, improves the ability to cope, and strengthens the immune system. So terms to know: circadian rhythm is an internal clock. It's 24 hours, day-night, sleep-wake pattern, and it reflects overall health of functioning. So if you're not getting enough sleep, we know where that leads. The reticular activating system, make sure that you look that up in the book. It's really important to have down the stages of sleep. They love to ask questions about that as well. So make sure you really look into that information in the book for sure. Light sleep, slow brain and body processes are associated with which? REM sleep. Light sleep, slowing brain and body processes. That'd be stage 2 of NREM sleep. Okay, so that's the exact question that they would ask you on the test as well. You have to know the difference between REM 1, REM 2, REM 3, REM, all of those things. So some factors that affect our sleep are age, lifestyle factors. The lifestyle factors include physical activity, food and alcohol, medications, caffeine, sleep habits. An illness might affect our sleep, and environmental factors like temperature and humidity, noise and light, noxious odors, and comforts of the bedding. So just imagine the last time that you tried to sleep after a night shift and the kids were really loud in the house and there was no way to dampen the light coming in. Similarly, when you're out camping on the top of the Beartooth Pass on July 4th and it starts to snow, the temperature can really affect it. Common sleep disorders: insomnia, the inability to fall or remain asleep or go back to sleep. Circadian disorders, abnormality in sleep and wake times, like jet lag, working the night shift, and rotating shifts. Restless leg syndrome, the uncontrolled movements of the legs during sleep or rest. Hypersomnia, excessive sleeping, especially during the daytime, sleep-related or disease-related, and can be related to depression. If they sleep all day, sleep all night. Sleep apnea are periodic breathing cessation for at least 10 seconds during sleep. And then narcolepsy, on the other side of that, is a chronic disorder caused by the brain's ineffectiveness to regulate the sleep-wake cycle. So it's uncontrolled episodes of sleep during the day, which can be extremely dangerous if you're driving a car. And then parasomnias like sleepwalking, sleep talking, sleep shopping, night terrors, REM sleep behavior disorders, or enuresis, which is bedwetting. The basis for safe and effective nursing care is thinking, doing, and caring. So you're caring for an older adult who has restless leg syndrome. What is it? What might you do to relieve the symptoms? And how might you show care and compassion to this patient? Think about that. So again, sometimes they say magnesium is an issue, that the magnesium level is too low. So if you take magnesium, it may help it. A nurse is caring for a hospitalized client who normally works the night shift at their job. The client states, "I don't know what's wrong with me, but I've been napping all day and I can't seem to think clearly." What would you say to her? Well, answering this in the least restrictive, least invasive, right? I'm not going to say I'll get you a hypnotic. Least invasive, least restrictive. D is out. I don't want to give her false hope, like A. And hypersomnia would be sleeping all the time. So that's not true. So the best thing that I can do is offer, what can I do to help you sleep better at night? The hospital routine has disrupted the normal pattern. All right, another one. For which sleep disorder would the nurse most likely need to include safety measures in the client's plan of care? Safety measures. Kind of said that. Narcolepsy puts them at risk because they could be driving and automatically fall asleep. So snoring, you're not going to die. Enuresis, you're not going to die. You might be embarrassed, but you're not going to die. But narcolepsy, you could die if you fall asleep at the wheel. Okay. So when you do an assessment of a patient with a sleep problem, you're asking them about their sleep patterns, their sleep rituals, their sleeping environment, sleep aids that they use, any changes or problems with sleep that have recently developed. And you're asking if they're ready for enhanced sleep, if they think insomnia is the issue, if sleep deprivation is the issue, or is there a disturbed sleep pattern? So to promote sleep, we tend to cluster or schedule our care in the hospital to avoid interrupting sleep, create a comfortable, restful environment, promote comfort and relaxation, and support bedtime rituals. This is good along the whole lifespan. It's not just one time. So I will key into maintaining safety of the client, offering foods that promote sleep, teach about sleep hygiene, and administer and complete client teaching about sleep-inducing medications. You're the nurse caring for a patient in the ICU who's wakened hourly for neurochecks. With the around-the-clock interruptions in rest and sleep, what problems do you expect the patient to develop? Probably going to get irritable with you, right? Probably not going to be fully rested. But we really need to wake this person up because we need to make sure our neurochecks are okay. So you have to come up with a reason that, this is for your best interest. It's only going to be a couple days. We need to do this, and talk them into it instead of talking yourself out of going in the room. All right, so some of the things on the tests related to this might sound like the REM sleep. Absolutely. Might sound like an employee who's having trouble going on to the night shift. She's making all these med errors. It's not chastise the nurse for making med errors. It's asking her about her sleep patterns. Ask yourself, what would you do if that happened? You would go to your manager and say, "Man, I don't know. You got any hints of how I can do this? Because I don't think I'm going to make it at night shift. My sleep patterns are just a mess," right? Maybe there's somebody on the shift that likes day shift more or night shift more, and you could switch with them. They can provide you some opportunities. But unfortunately, a lot of places you do start off on the night shift. So you need to be honest and open with your manager that you're really having trouble with this sleep pattern rather than make mid errors. All right.